Well, smoking remains the leading cause of preventable death and disease in the United States. It kills more than 480,000 Americans every single year. Tomorrow, the Northeast Tennessee Regional Health Office is launching an anti-tobacco campaign. And here to tell us all about it are Crystal Robertson and Vicki Casenburg. And it's great to have both of you with us.
Thank you. It's great to be here.
Well, you guys are from this area locally, so let's start there. Tell us a little bit about tobacco use in the Tri-Cities and what you guys are seeing.
Well, we see about 30% of our population in this region smokes, which is higher than the state average. And also 30% of our pregnant women smoke also. And so we have three focuses to our campaign. Our first focus is preventing kids from starting to smoke. And we know that 9 out of 10 kids, if they start to try tobacco before they're 18, they will continue that as a habit. So that's our first leg of the campaign.
And you guys are actually partnering together to do this. Give us a little bit of some background on this campaign.
Sure. Well, in 2013, Governor Haslam appropriated funding from the Tennessee Tobacco Settlement, and it was given to all 95 counties, including us here in Northeast Tennessee. And the reason that he attributed this money was to focus on 3 priority areas or 3 focus areas. It's a 3-year grant or program. The first area we wanted to focus on was to prevent youth initiation. We never want to see our youth start using tobacco.
And you're actually gearing toward very young kids, like 8, 9, all the way up to their teenage years.
Absolutely. It's never too early to start talking about being healthy and being active and being addiction-free.
Okay.
The second area of the campaign is actually addressing pregnancy and smoking, which is a disparate population in our area. We have very high rates. As Crystal said, some of the highest in the state. So we are addressing that. Okay. And then the third area is eliminating exposure to environmental tobacco smoke. So in other words, secondhand smoke. There's no safe amount of secondhand smoke, and we really want to continue to educate the public about that.
So this is the campaign that you guys are launching. It's going to start tomorrow. You're going to see television ads and radio. You're going to be hearing about this and really getting that message across. How important is that education?
It's very important. We wanted to have a media campaign that was, you know, solid and everyone would see it in the region and just really get out there and be seen. And so that's what we wanted to do. And so we pulled our money together to do a regional campaign and reach everybody in the upper 8 counties of Tennessee and just to reinforce that message everywhere that you turn. So.
And education is so key, and reaching those kids at a young age.
Absolutely.
Yeah. And so we're going to start to see this. Is there a website that our viewers can go to for more as well to learn about the dangers of smoking?
There's not a website that you can go to, but you can call your local health department. We have some cessation programs going on. We've got some great incentives for pregnant moms to quit smoking. And we're out in the schools, we're on Twitter in Sullivan County, so the Unsmokable program, so we are out there and we just want to get that message out as much as possible.
And certainly reaching those 3 populations.
Absolutely. ETSU we collaborated with for this program, the coaches there on the Don't Start campaign, and it's been a great collaboration. They've been so wonderful to work with, and you know, our youth in this area will graduate from high school and most of them will go on to ETSU. And since it's a regional university, coaches can send a message to youth and youth listen.
Yeah.
So.
Well, certainly a wonderful program, ladies. We thank you so much for coming on the show. Thank you for what you are doing for the community.
Thank you.
It is the Don't Start campaign, and for more information, you can visit your local health department. We're back with more of Daytime right after this.